We could be headed for a gloomy period as the Kenya Medical Research Institute, KEMRI, now projects that COVID-19 cases and deaths will spike in mid-March. KEMRI's latest publication, dubbed Projections of COVID-19 Cases and Deaths Following Schools Reopening, indicates that the country could hit the 1.1 million infections mark by June this year. Dorcas Wangira reports.
Sit down.
With schools having reopened and Kenya recording a test positivity rate of below 5% consistently in the past 2 weeks, it may seem the country is bordering a flattened COVID-19 curve. However, KEMRI's latest projections released this month predict that the impact of schools reopening could only be clear in terms of numbers by mid-February.
According to WHO standards, when you have tested below 5% for the kind of period that we have, normally you would consider yourself as on the way of at least having flattened the curve. However, as I've repeated in the past, we have maintained higher surveillance than would be normal because some of the measures we have taken, especially the opening of the schools, are pretty heavy events. And we do not want to start declaring ourselves having flattened the curve and then immediately start going backwards.
KEMRI, through a publication dubbed Projections of COVID-19 Cases and Deaths Following Schools Reopening, projects that the effects of schools reopening could lead to a rise in infections by 13,700 new cases and 160 new COVID-19 related deaths by June the 1st this year. The impact of other events such as new variants of the virus could increase the RT, which is the average number of new infections caused by a single infected individual at a time in the partially susceptible population, by more than 25%, and case numbers and deaths exceeding KEMRI's predictions. This is because variants make drugs and vaccines less effective and also cause more severe illness.
Viruses will undergo transformation in order to make them more virulent sometimes, less virulent, or sometimes the transformation is neutral, or sometimes is of unknown significance. And of good note, again, coming from the scientific world, is that even though the variant is more transmissible, it is not more virulent than the novel COVID-19.
As at 11th January, there was no evidence that the two strains of concern, the UK variant and the South African variant, had been introduced and were circulating in Kenya. However, 13th January, KEMRI detected a different, distinct variant from the one in the United Kingdom and South Africa from 6 coastal counties, Taita Taveta, Kilifi, Kwale, Mombasa, Tana River and Lamu. And on the 21st January, Wednesday, 2 asymptomatic persons infected with the South African strain were reported to have left the country.
Indeed, you have reported 2 cases of the South African variant of the virus that was picked by a team in KEMRI Kilifi. We all know that this variant is 50% more transmissible, therefore posing a significant risk in that more people will be infected.
In the last 24 hours, 186 more people have tested positive for COVID-19 out of 8,049 samples, bringing the total infections to 99,630. 3 deaths have been recorded, bringing the total number of fatalities to 1,739. 75 people have recovered, bringing the total number of recoveries to 82,729. Dorcas Wangira, Citizen TV, Nairobi.